My name is Mark Wevill. I'm an eye surgeon and I specialize in helping people to see better. There are lots of ways I can do that, and let me show you. I've got a little model here and I'll demonstrate a little bit of that. So when we look at the eye, it's like a camera, and there are two lenses in the front that are supposed to help everyone to see better and work together, and they're supposed to focus everything at the back of the eye. Unfortunately, things don't work so well in some people. So either we can operate on the front of the eye here and do laser eye surgery, or we can do lens surgery and remove this lens. This lens ages as we get older. So when we're young, it's young and flexible, and there are little muscles around. You can squeeze on it and change its shape to give you distance and near vision. Unfortunately, as we get older, that gets harder, so it stops flexing, and when we reach our late 40s, you start to need reading glasses, and eventually also the distance vision starts to get worse. And we can put in new lenses which give you the distance and the near vision and clear that up. But there's a third stage of the lens aging, and that's when it goes so hard that it starts to form a cataract. And when that happens, we need to remove that and replace it with a nice clear lens. And once again, we can help you to rejuvenate your vision and to be able to see in the distance and nearby with special new high-tech lenses. But you've also probably heard about laser eye surgery. Now, laser eye surgery tends to be done in younger people, and that's done on the front of the eye here. This is called the cornea. And the cornea has a certain shape, and if we change that shape, we change the focus of the eye. So all the lasers does is reshape that, and it's usually a slightly different shape, sort of a flatter shape or sometimes a steeper shape, and we can correct vision that way. So if you come to see us, we can correct your vision in a number of ways. Of course, there are even more ways to correct vision, but that's for a more detailed conversation. And you're welcome to come and see us, and we'll be able to help you and advise you and give you a personalized, customized approach to solving your visual problems just for your lifestyle and for your visual needs.